Well, staying with the COVID-19 pandemic and the need to flatten the curve, the CEO of Outreach Group of Hospital, providers of acute health care to women, babies and children in 5 centres in Lagos and Delta State, Dr. Dosekun, joins us on the program. Now, Dr. Dosekun is a renowned pediatrician, the acting chairman, Society of Emergency Care Practitioners, and a partner, Vesta Healthcare Partners, a health management consultancy company. She is passionate about advocacy for innovative health system development in Nigeria, particularly in areas of primary care, emergency care, and human resource capacity building. Dr. Dosekun, welcome to the program. Doctor, we've been told that the pandemic will stay with us for some time. We've also been seeing, or started to see, infections amongst children. Jigawa State yesterday, a 6-year-old girl, daughter of an index case, and then several Almajiri children also across the northern region. How does COVID-19 affect the child?
COVID-19, for some reason, at least at the beginning of the epidemic, children were not affected. But as the epidemic goes on and infects more people, there's going to be increased contact and eventually children will be affected. But there was something protective at the beginning, but I think the scene has changed.
And it's not as if the virus has changed, no?
No. For now, I don't think we have much information, scientific information on mutations. I think it's just a history of, or what we're noticing now is that the more you have physical contact, because we as humans are acting as the transmitters. So if your children are in close contact with you and you are infected, there is the risk of that child being infected.
We've taken a decision to still shut down schools,
yes.
But we know that children always play and, they're always friendly and all of that. How does the virus affect the child such that we can limit the spread?
I think that is why there's been a bit of a hold-up in most countries about children going to school. And if children are going to go to school, there needs to be some very clear instructions. It has to be a command type of style. It might have to be the NCDC or maybe the primary care agency. There has to be the advisor and the monitoring, and they would be taking action. There must be some central point that would give the instructions, would monitor, would advise on what to do. So I think if the schools are going to they're going to open, I don't know when the federal government is going to give that initiative for that to happen, we have to be very careful. And we might have to continue doing the infrared temperature testing before the children come to school.
Washing.
We need to do the hand washing. So there might have to be some change in the infrastructure in our schools, because it might be wise to put, like outside my hospitals, there's a station where you can wash your hands now. And we might have to have that for the school children. And things like sporting activities, we might have to put a hold on that, where there's going to be a lot of contact. And we've got to be very sensible. If not, the disaster can continue.
So it will be a different world for our children.
Yes.
So if a parent or a guardian notices that, their child has COVID-19, what are they supposed to do?
I think quite a lot of times they're not going to know the child has COVID-19. They're just there's going to be a fever, or there must be some respiratory symptoms. I think the first thing is parents have to be a bit extra, aware of how their child is performing. We've got to be very sensitive. And if the child has a fever with respiratory distress or significant diarrhea, you must call your hospital. Most people at least have some physician they can call on to when there's problem. I think it's better to route it through the physician than through the pharmacy, because then they can really go through the clinical symptoms and signs and decide if this child needs to go to an isolation center. But I must tell you that this is going to be very difficult, particularly for us in the tropical countries where fever in children is very common. And most of the time it's due to malaria, a diarrheal illness, or bacterial infection. And so we don't want to have the case where the child is waiting at home while that disease is ravaging the child's body, only to be told a few days afterwards that, don't worry, your child is not COVID positive. So there has to be a lot of sense in this, and a lot of guidance has to be given by the physician.
Does the virus affect a pregnant woman differently, and can she pass that on to her on long term?
Generally, when pregnant women do get an infection, the symptomatology and the effects is normally worse, even with malaria, with bacterial illness, with viral illnesses. So that can happen too, and I think it has been reported even in Nigeria as a case study. And it can spread to the fetus because there's just one communication, a common communication called the umbilical cord, between the mother and the fetus. So.
And also a nursing mother as well. So let's talk about perhaps what children can take, and even adults. We've heard about vitamin D. It's been a sort of precautionary measure.
Yes.
What's your take on that?
Yes. This is quite topical now because the events of the last few months have a lot of people, both public health, public health officials or leaders, policymakers, academia, scientists, and we're all looking for I would say, okay, like the Holy Grail. What can we do not to have? And I don't think anybody has any single scientifically proven. It's just, there's been some science work and there's been some association. But I think the story of vitamin D, at least in Africa and Nigeria, is one for a scientific conversation. Because vitamin D they call it the sunshine vitamin, and it is known to help the immune system. When I was in medical school 40 years ago, the only function we knew vitamin D had was bone metabolism. That is, to make our bones strong. And if you don't have enough vitamin D, the children have soft bones and they become bow-legs and have swellings at the wrists. And if you're an adult, you have weak bones. They call that osteoporosis. But along the years, there's been a lot of work done on vitamin D, and we find that it does support the immune system. It helps our immune cells to fight. And there's another very important function. When you have an infection, for most people, the immune cells contain that infection. You pound that pathogen, and that's just the end. So you're a bit sick. You could recover on your own, or you might require some antibiotics or antivirals or antiparasitic drugs to help you. But on some occasions, which might be because of the pathogen, like this pathogen, this novel virus is so virulent, or it may be that the host, that is the patient, his immune system is very weak due to some illness, or due to poor nutrition, or due to even depression. Depression has been associated with a reduced immune state. So what vitamin D does now is that it helps to support. So people are out there now, the scientists are now saying, so should we not be advocating for people to have good levels of vitamin D, especially when we know it, you can get it free from the sun. Okay. 15 minutes contact with the sun in the morning.
So between 7 and 8.
Will enhance your vitamin D levels.
Okay.
So it's only sensible to say, let's do all the little things that will boost your immunity. So if this bug comes, our immune system will be able to crush it off.
We'd like to thank you, Dr. Dosekun. Thank you for joining us on the program.